Hello, I'm Joshua Freitas. I'm going to be instructing a group of individuals about insulin administration. Now, this target audience is going to be very wide because anybody can be diagnosed as a diabetic and need to inject insulin due to their blood sugar being too high. So we're talking about insulin administration. This is for my nursing, teaching, and education class here. And like I said, I'm Joshua Freitas. Moving on here. What you want to look for when you're administering insulin or diabetic are signs of hypoglycemia. Now, hypoglycemia is, of course, low blood sugar, and this can include some symptoms such as shakiness, nervousness, or anxiety, sweating, chills, and clamminess, irritability or impatience, confusion, including delirium, rapid fast heartbeat, lightheadedness or dizziness, hunger or nausea, sleepiness, blurred impaired vision, tingling or numbness of the lips and tongue, headaches, weakness or fatigue, anger, stubbornness or sadness, lack of coordination, nightmares or crying out during sleep, and if it gets too bad, seizures and unconsciousness. Now that's a huge list, and you think, well, you experience some of these on a daily basis anyway, but once you get more in tune to your blood sugar levels and how you feel during this, then you'll be able to narrow it down when you're less likely to have to check your blood sugar at that time. Some signs of hyperglycemia, of course, on the other end of the spectrum are high blood sugar, of course, hyper meaning high levels of sugar in the urine, which you can usually smell. It'll smell sweet, frequent urination, and increased thirst. Of course, hypoglycemia is more dangerous than hyperglycemia. Hyperglycemia is going to tend to hurt you in the long run, whereas hypoglycemia can lead to coma and even death. So our supplies here are a bottle of insulin. We have a sterile insulin syringe, wrapper's already removed. Okay, we have some alcohol wipes. It's important for sterilization. And a container used for disposal here. Of course, I'm just using a cardboard box, but if you had one at your house, it would have to be a Sharps box, Sharps container to safely dispose of the needles. All right, so what we do is remove plastic from the needle. We're going to go ahead and roll our insulin, and I'm just going to follow this. You would roll the insulin, get air bubbles out of it. If you're mixing insulins, which not everybody's going to have to do, you would kind of roll it to mix it. You don't want to shake it or agitate it too much because it'll get air bubbles in there, and you don't want any of that. So then you're going to wipe off the rubber top of the insulin. It's important to note that some people are going to ask, do they need to wash their hands or wear gloves? Just wash your hands for these procedures. Okay, so set the insulin bottle on a flat surface like we have here. Okay, so now you'll remove your needle from your cap. Be careful because that is a sharp needle. Insert the needle into the rubber top of the insulin. Okay, right in the center. Now, when you're inserting it into the rubber, you need to make sure to use different areas of the rubber, because if you insert it in the same area, it's going to degrade the rubber. Okay. Turn it upside down, and we're going to aspirate the needed amount of insulin. We're going to say 5 units based on our sliding scale here. Then you remove the needle, and we're going to replace the cap. Okay. Now, if you have a big container, it's good to sometimes put in the amount of air in units into the bottle as the amount of insulin you're taking out, so that you don't get too much negative pressure inside the bottle. but don't overinflate it either. Okay, so we're good on our aspiration here. Now we're going to talk about self-administration. Of course, I'm not diabetic, so I've brought this little pad here we're going to use. So what you want to do, use another alcohol pad, and we're going to rub the site. This is always just to prevent infection here. Okay, and since I can't hold that and do this at the same time, I'll remove our needle. Okay, we're going to pretend this is my belly. You'll pinch up about an inch of fat if you can here. Get the needle ready, and what we're going to do is go in at a 90-degree angle, just quickly. Pop it in there. We're going to inject the insulin in, and then quickly pull out without rubbing. And at this point, you don't need to put the cap back on. You can just throw it in your waist. And at that point, if it's bleeding, you can always just put a Band-Aid on or something. It usually doesn't bleed, I've noticed on patients, but if it does, a little Band-Aid will suffice. Okay, and that's it for the injection here. Any questions? And since I do not have an audience, I've prepared 5 questions. Will the insulin injection hurt? Well, yes, it's likely to hurt initially, but as you do it, it's going to become less of a pain for you. You're going to be used to it at that point. So yes, it may sting a little bit at first, but the insulin is not going to burn generally. Do you have to refrigerate the insulin? Yes, you have to refrigerate the insulin. Okay, it's a hormone and it can go bad, so it needs to stay in the refrigerator until use. So you take it out, do our procedures here, put it back in the refrigerator until next use. How much insulin do I need? Well, this is going to be specific to your own needs. Of course, the doctors will likely prescribe you a long-lasting insulin that you'll take, as well as a short-acting insulin. So you'll take your long-lasting, which will be a set amount of units based on your own metabolic needs, and the short-acting insulin will be based on a sliding scale depending on carbohydrates you've had throughout the day and what your blood sugar is at. So the higher blood sugar is, the higher the dose of insulin is going to be in units here. Of course, it's very important not to overdo your insulin. That can lead to hypoglycemic shock, or insulin shock is what they call it. And hypoglycemia could very well end in coma and death if you do not pay attention. Can I reuse the same needle? It's against our advice to reuse the needle. It's, for one thing, if anything, the needle is going to become dull. It's going to be harder to stick in. I mean, you have to think you already stuck it into the rubber spot here, and that's going to dull it a little bit. Some people actually like to use 2 needles, one to aspirate, switch out the needle, and then use it for your skin so that it goes in quicker and easier. But also cleanliness. You don't want to reuse needles, get bacteria on there, and that kind of thing. It's going to lead to infection if you continue to use the same needle. Do I have to wear gloves? I know I kind of covered this, that if you're at home in your own setting, it's just good to make sure you wash your hands. Maybe sanitize your hands if you have something, but it's not necessary to wear gloves. It doesn't need to be sterile, but do wash your hands. That would be good. Okay, and here's my references from where I got my information. As you see, my book, American Diabetic Association, and WebMD, of course, right? That's where everybody gets all their information. Well, that's the end of my slideshow, and thank you for watching.